I'm Harry Rock, and welcome to another edition of the Westfield Council on Aging Presents. This is a special collaborative effort between Mike Squindo, Executive Director of the Westfield Senior Center, Tina Gorman, COA Special Projects Coordinator, and Pete Coles, producer of WCPC Westfield Cable Channel 15. Our topic today is hypertension, and my guest is Dr. Nitin Bhatnagar, who is a cardiologist and who is the newest member of the Westfield Board of Health. We are going to be discussing hypertension and the dangers of high blood pressure. So Dr. B, as you're more fondly known in the clinic and with your patients, welcome to the show. We're thrilled to have you.
Well, thank you for having me.
Absolutely. I always like to kind of start with our audience to give them a sense of just who you are, because you're a new face to some of us. I haven't met you before myself. And I was just curious, you are a cardiologist by trade. How long have you been a practicing cardiologist?
Almost 20 years.
Wow. And what got you interested in that initially? Was that something you had thought about as a child growing up? Or?
Actually, yes. My father's a cardiologist, and
Wow.
I've been wanting to be a physician since I was about 2. And I used to, ironically enough, we're talking about hypertension. Since the age of about 3 or 4, I've always wanted to be a cardiologist. And then even when I used to have my friends come over, and all my little 5-year-old friends, I would have them all lie on the table, and I would just check everyone's blood pressure. And ever since then, my parents realized, you know what, he's probably going to be a doctor. So ever since that moment in time, it's been embodied in me to be a physician and eventually become a cardiologist.
Wow. And I'm guessing your dad's probably thrilled that you followed in his footsteps.
For the most part,
What
yes.
a great role model. Yeah, what a great role model. And so you are also the newest member, as I understand it, of the Westfield Board of Health. Is that correct?
Yep,
And
I
how
joined
long?
this year.
This year. And what got you interested in that?
To being able to help a community at large and be able to provide more education. So I do a lot of writing anyway online, on social media, my blogs and so on mind, spirit, and consciousness. I do a lot of teaching with residents, fellows, medical students, PAs, nurse practitioners, students, and the like in the medical field. And I always wanted to provide more teaching to the public at large.
So let's get started with just talking about the topic. What exactly is blood pressure in general before we get into high blood pressure? What is blood pressure so people understand what we're talking about?
Sure, fair question. So blood pressure essentially is the force exerted by the blood against the walls of the arteries. And that's essentially, as the blood travels throughout the whole body, that essentially is your definition. It is the force of the blood as it hits the blood vessels.
Okay.
Now, there are 2 parts of blood pressure. There's the top number and the bottom number, as we all know.
Oh, right.
So you've got your systolic blood pressure and your diastolic blood pressure. Those are just fancy names for systole, meaning it's the phase in which the left ventricle, that part of the heart on the left side, that squeezes.
Oh.
And that's how you determine in the systolic phase, that's your blood pressure.
Okay.
Now, your diastolic phase is when the ventricle relaxes and starts to fill. That's your bottom number.
Oh, wow.
So you've got a top number for when the ventricle squeezes and the bottom number for when the ventricle relaxes.
Okay.
That together comes up as your blood pressure.
And I'm assuming that each number is independent of each other, but just as important.
Correct. Yes. Okay. So we look at each individual number, but we look at both together, and we also look at the difference between the two, and they're known as the pulse pressure.
Okay. And then what is considered a normal blood pressure?
So 120/80 is the standard based on the guidelines. As you start increasing blood pressures, the different stages. So a stage 1 blood pressure is 130 all the way to 139, with the bottom number 80 to 89. Then stage 2 is now you're going into 140 to 149. And then the bottom number is your 90 to 99. And stage 3, when you're talking about blood pressures of above 180 over 120. Now you're starting to head into hypertensive crises or hypertensive urgency and that realm altogether.
And then what is it that causes blood pressure? It escalates over time. And what is that a symptom of? Is it diet? Is it general health? Is it age?
All of the above.
Okay. So I'm guessing pretty well so far.
and much more. So usually age does correlate to increasing blood pressure. If you look at some of the statistics, above 70% of people above the age of 65 have elevated blood pressures. And that sort of correlation begins even when you're at the age of like 18 to 29. There's about 22% of prevalence. And then that goes up to the next stage to almost 55% prevalence between the ages of 40 and 59. And then when you start reaching 60 and above, you reach almost above 75% of the prevalence of high blood pressure. So age is one factor. You've got also sleep apnea, dehydration. There are lots of other possibilities. Other heart disease, history of diabetes. There are also exertional things such as the weather can also contribute to blood pressure changes. What I would like you to think of as blood pressure is not as a problem, and this is a disease pathology, but think of it as a feedback mechanism of the body as blood is flowing through it. In order for you to be able to see what and tell what signs and symptoms are going on, and using the blood pressure as the guide. To be able to see, okay, what's going on in the mind, because stress can influence blood pressure. What's going on in the body? Are there any illnesses going on? Are there any nutritional deficiencies or excesses like salt and sugar that can be contributing to the blood pressure? The blood pressure is an organic part of us. It is not. Don't think of blood pressure as this is a problem or this is a bad thing. Blood pressure, high or low, or even in control, is simply just a gauge of what's going on in the body and how the body is reacting to its internal climate and the external climate. So that essentially is how I look at people when I'm treating them for their blood pressure. I'm trying to see what else is going on with their life.
That's fascinating. I never thought of it that way. So high blood pressure by itself doesn't tell the entire story. You've got to treat that and, okay, we have a symptom of high blood pressure, but that's been brought on generally by something else. So not only are you dealing with the high blood pressure, but we now have to kind of research and figure out what is causing that or what's triggering that.
Exactly. So when I look at somebody, yes, I've got they're in front of me in the office. I'm taking care of their blood pressure. I've got medications in my toolbox. But in addition to that, there are lots of other tools that I use because I need to try to figure out what the cause of the blood pressure is. For all these illnesses, and we're talking about hypertension, but for whether it's diabetes, cholesterol, history of stroke, heart disease, whatever the case is, the idea is to figure out why this happened in the first place. There's a mind-body connection to the experience. There is a pathologic component to the body experiencing the illness, whatever that might be. Think of it this way. Don't look at illness as a problem, but look at it as out-of-balance wellness. So the body is able to homeostatically regulate wellness at all levels, cellular, organic, at the musculoskeletal level, all the systems involved, at the brain level. And anything that is out of balance eventually will translate into illness. Think of it as disease split apart, dis-ease. Where's the ease in our body that was naturally there that is now out of equilibrium, and now we need to figure out what that is. So I do that for blood pressure. So yes, I will look and see the person's age, obviously, when they first come in. I will look and see what other cardiac risk factors do they have. Do they have any things like issues like sleep apnea? Do they have diabetes? Do they have atrial fibrillation? Do they have... I don't like to blame anything just on age. Let's put it that way. Even though age is a major factor, and as we get older, age does contribute to our blood pressure going up. And that's mainly because as our arteries get stiffer and stiffer, they're now turning more, instead of pliable vessels, they're turning more into copper pipes, as it were, and they're getting stiffer and stiffer. And so that's why it's giving the elasticity changes. And that elasticity change will now generate the blood pressure. Because as you remember, we just mentioned, was that it's all about the force that's being generated against the walls. If the walls are getting stiffer and stiffer, then you're going to have a problem long term.
So I often hear blood pressure being referred to as the silent killer. And can you relate or can you describe what that means?
Because most people are not going and checking their blood pressures.
Okay.
That's one of the things.
So they're not aware of it.
They're not aware of it. And that's the beauty about having these kind of educational sessions, which is we get people to be more aware and alert of what's going on.
Right.
So there's some interesting statistics. Globally, 34 and 32% respectively of men and women have diagnosed high blood pressure. And that's about 1.6 billion people in the world. However, imagine how many people are not diagnosed with it, because we know that it is so prevalent, and 70%, as I just said, at least above the age of 65 already have it. How can we not do due diligence to be able to find beyond the 1.5 billion people in the world who are not suffering from high blood pressure? And sometimes the first time we find out that they've got high blood pressure is stroke, heart attack, or death. So that's why it's very important to keep an eye on blood pressures on a regular basis.
And that statistic again, 70%
Above 70%
of people who are 60
are above 65. 60
Have-
to 65 have high blood pressure.
pressure. Wow, that's interesting. Can you go through life into your 80s or even 90s and not get high blood pressure? Or
Probably. There are people who can do that, and that's not necessarily a function of what they're not doing. It's a function of what they are doing, which is they're eating healthier. They've got good, stable mental processes. They are staying very well hydrated. They're exercising. They're doing the things that will help you control blood pressure. Once the cat's out of the bag, doesn't mean to say that we can't put the cat back in the bag by simply controlling all the other risk factors that are involved as well. It's not just medications.
Okay. And if you've had normal blood pressure and then it begins to escalate, are you able to reverse that at all? Or once it starts going up, that's it, it's going to continue to rise?
If you don't do the medications and you don't do the lifestyle changes and you don't find what the cause was, then the blood pressure can continue to keep on elevating.
But you can bring it back down.
You can bring it back down. I have plenty of patients who we figured out the underlying problem was their sleep apnea, and they used to be on 3 to 4 medications for their blood pressure. And by simply controlling the sleep apnea, we were able to cut them off and down to like 1 medication. So we were able to knock off at least 3.
Wow.
But we figured out in those patients what the cause was.
Wow, that is really fascinating. So I will say to our viewing audience here, if you do have high blood pressure, you need to be looking at other root causes because there may be something else going on. That's really, really fascinating.
To that, sorry to interrupt, but I would add to the audience is that it's not just for hypertension. Whatever the illness might be, look for the root cause.
Okay. And I love that analogy of disease. Ease meaning we're normal.
Equilibrium.
Homeostasis
lies.
Dis-ease. This is okay. We're out of sorts here.
The disequilibrium.
Right.
Yeah.
And if you have high blood pressure, are there symptoms that you physically feel, or is it really invisible to you?
Some people actually will feel their blood pressure. They will feel more fatigued, short of breath. Some people experience chest pain. If the blood pressure is extremely high, like we're talking like above 180s, systolic blood pressure, and even the diastolic, well above 100, some people can experience headaches, vision changes. They can actually even hear the pulse in their ears, things like that. So people can have, and on the other hand, you've also got the same gamut of people who don't even know that they're even having the high blood pressure and they're just feeling just fine. Probably because the fact that they have tolerated a high blood pressure for so long, at one point they probably had some symptoms, but somehow or the other unconsciously they've ignored those symptoms, and now going forward, years and decades later of high blood pressure, they've just sort of used to whatever it is and don't even realize that they've been experiencing high blood pressure. Their body has adapted to that high level of blood pressure.
Can you have, say, normal blood pressure, say you're 115 or 117, and you go to the doctor's office and, I'm assuming when they do a manual, I'm assuming when they do the automatic one that it's pretty consistent, that the machine never makes a mistake. I know when you're doing a manual one and they're listening with a stethoscope that they could maybe misread a beat or two on the high or the low. Is that a possibility?
Possibility certainly is there. That's why you've got to have a well-trained person to do the blood pressure and make sure that they know what they're doing, listening to it a few times if they have to, right? And to being able to know where they're called the Korsakoff sounds, and to listen to where that blood pressure starts to drop off and then where does it pick up again. Okay. Sometimes you can have that, and that may be a sign of some other pathology of the heart. So it's important to know how to the proper blood pressure readings. That's one aspect. I don't put 100% stock in all the automatic blood pressure cuffs because who's calibrating these, right? So sometimes these things,
That's a great
when you
point.
go to some of these local places where they have the free blood pressure cuff, I don't think people are sitting there calibrating these blood pressure monitors. And then again, also, if you see the way people are
interesting.
checking the blood pressure, that's also important. And what I tell patients is that make sure when you check your blood pressure, you've already gone to go pee, you've already gone to go poop, and you are not, drinking a cup of coffee while you're checking your blood pressure, or you're not trying to smoke a cigarette while you're trying to check your blood pressure, right? And you keep both feet down, you check your left arm, you've already gone to go pee and poop, and now you sit down and check your blood pressure. And let's look at what those real readings are like. If you're doing it while on the fly, well, that's a different story. That would be more of a stress test, checking what your blood pressures are like. The reason I bring up that analogy is because when you walk around in these supermarkets and so on, and you say, well, I'm just going to go over here and check my blood pressure. Well, what's happening? You're walking in the store for a few minutes at least. You're pushing a heavy cart, potentially, right? And now you're sitting down and checking the blood pressure. And the monitor may not even be calibrated. There are so many possibilities of error here that's why I tell people to get their own blood pressure monitor and do their blood pressures at home and bring it to my office, or when you go to your healthcare professional, get it checked by their primary so you can get a manual and an automatic blood pressure cuff done, and we know what the readings are like.
You are raising some great points here. This is really fascinating. So to the point of if you're walking around pushing your grocery cart and stuff, are you actually elevating your blood pressure just through that amount of exercise of walking,
Potentially.
and pushing, and
Yeah.
so that could give you an artificial reading of where you are.
Right.
Right.
Yeah, but if we want to know what your blood pressures are doing exertion, then that's another possibility. And that's why when we do stress tests in the cardiologist's office, you're running on the treadmill, and we are checking your blood pressures every 3 minutes and seeing what the readings are like.
So much like when you're taking your resting heart rate, they always say take it when you first get out of bed, when you first wake up, because your body is relaxed, you've been sleeping. Don't take it in the middle of the day when you're rushing around and stuff, because your heart rate's going to automatically elevate. So I'm guessing that the blood pressure is kind of in that same realm.
Right. And blood pressure is meant to vary. You can't stick to 120/80 all the time. Let's say if you're eating something that happens to have some salt in it, your blood pressure will rise. If you are rushing and doing something, your blood pressure will rise, as will your heart rate vary. So it's overall looking at a trend. And so I don't look at one blood pressure reading or one heart rate reading and make the diagnosis. I want to see a whole trend. And not just a trend for a day, I want to see a trend for a month. And I want to see all the readings. And I advocate for all my patients to go get their blood pressure monitor, bring it back to the office so I can check it, and also get your readings. And let me take a look and see, where are we? When do your blood pressures go up? When do they come down? Do you have any symptoms? And when you have symptoms, is it because your blood pressure is high, or actually your blood pressure was normal and you were having some symptoms and it has got nothing to do with the blood pressure? So correlation is important once you are able to see the full picture and getting more blood pressure readings, more data points.
And so if you have, so I take myself as an example. If I have a consistent blood pressure of, say, 115, that's what I always seem to be at, but then I come in and one day I'm at 130 or 135, that doesn't mean that my blood pressure has risen and now I'm at that higher level. It could be something else that's just pushing it that high.
Correct.
But my normal range is still around 115. So a blood pressure can go up and down.
Correct.
Okay.
That morning you could have been late for work. You could be stuck in traffic. You could have been cut off. Now you're getting all enraged. You're behind the eight ball when you come to work. You've had your cup of coffee. That's also stimulating it. You may not have had enough hydration night before. You might have had to go out to eat and eaten some salty food in a restaurant. All these things can play an impact on what your blood pressure is. And also, a very important thing is people forget sleep. If we don't get enough sleep, our blood pressures can go up. So if we haven't had a good quality sleep all night long, the blood pressure may very well be elevated. And I've seen that in practice. When people have, working third shift or whatever, and they come in and they still have been working. They've come straight from their job and they're exhausted, they're tired, and we check the blood pressure and it's elevated. That doesn't necessarily mean that that's their normal average blood pressure. Because then when I look at their diary, the diary might be absolutely fine. So you have to put a lot of different parts of the pieces of the puzzle together to be able to figure out what someone's blood pressure is like.
Wow. So I guess the takeaway I would have on this is that people shouldn't panic if they have a number one day that's all of a sudden much higher than what they normally would see, that they really need to look at the big picture, not just one particular blood pressure test or two.
Correct.
They need to look at a whole series over a period of time, as you were mentioning.
Yes. However, the only times I would definitely say, listen, you've got some alarm bells running, is that if you've got now blood pressures of like above stage 2, so you're hitting 150s, 160s, 170s, and also especially if you're hitting that emergency crisis thing, those are the times that you should definitely get something looked at, and especially if you're starting having symptoms, right? Looking at the symptoms that someone's experiencing. Let's say someone's blood pressure is 180 and they're having chest pain. That's not the time to say, well, I'll just see what my average is like. The chest pain, the high blood pressure, okay, that's a warning sign. Listen to what the body has to say. All the symptoms that the body is giving out, whether it is palpitations, whether it is chest pain, shortness of breath, fatigue, etc., are ways the body is trying to communicate with us and trying to get us back into presence to listen to what's actually going on internally. So I would encourage everyone to listen to their symptoms. Don't blow them off.
Really, really interesting. Are certain ethnicities more prone to high blood pressure than others, or types of people?
African American population, we once thought that was more higher risk for high blood pressure, but we're seeing that more as a function now in people of different societies. So where are you going to compare a rural versus a urban person?
Oh, that's a good point.
Are you comparing a white population that lives in this environment versus in the other environment? It's because the same thing also happens even when we look at people's diets and their cholesterol and their overall risk factors, whether it's diabetes, high blood pressure, their lipids, whatever the case might be. We're now seeing, and we're a very global community now. And so you'll find blood pressures are variable in Europe, they're variable in Japan versus in the U.S., right? The blood pressures in this country are much higher than they are in other parts of the world. So it's not, and since we are a more closed global community, from a genetic standpoint, we can't now isolate different races.
Oh, interesting.
Everybody is now more mixed.
Right. Yeah, that's interesting.
So that's why I'm looking at a more global point of view of how to approach them.
Really cool. So let's talk about treatment options. Someone is diagnosed with hypertension. What are their options?
Lots of them. So,
oh, you know what? Before I go to that, I had another question. I just forgot that. How often should people get their blood pressure taken before we go to treatments?
So I would say that they should check their blood pressures. If they already have bona fide blood pressure issues and hypertension and you're being treated for it, then get it checked, at least a few times a week.
Okay.
Now, if we are doing your adjusting medication to see where we're going to get there, then check it every day.
Okay.
But if you are just randomly wants to just know what your blood pressures are doing, a few times a week should give you an idea.
Okay.
If the numbers are all fine, then do it maybe once or twice a month.
Okay.
But the more that you're finding that you got higher readings, the more readings we need to be able to see what's going on in your life.
Right. You're creating that baseline.
Right.
Okay. That's great advice. So now let's go to the question of treatment options. Somebody's been diagnosed with hypertension, high blood pressure. What are the options that they have in front of them that they should be exploring?
Okay. So I first jump to, first I see what the blood pressure is doing.
Okay.
So if the blood pressure is like 180 over something, you're going to need to be on medications.
Okay.
Because I've got to bring that down. I can't have you roaming around the countryside with potentially getting a stroke or a heart attack. So I would like to have lower blood pressures. But let's say someone's blood pressures are 140s, 150s. Then I would say, all right, you know what? You do need to be on something. So we'll start with some medication, right? There are plenty of antihypertensives out there. There are the diuretics, the beta blockers, the calcium channel blockers, the vasodilators. There are lots of medications and different classes of medications that we have to figure out and tailor what's best suited for you. given also if there's any pulmonary issues going on, is your heart rate too low, what's going on, and therefore in that setting, find the right drug. Is there kidney failure? Is there diabetes? Because some medications work better if you're already a diabetic and you've got some kidney issues, because it's like killing with two birds with one stone. You want to be able to help regulate kidney as well as the blood pressure, as well as control the diabetes. So there are drugs these days that can do almost polydisease, as it were.
Wow.
But on that same point, let's say if the blood pressures are 130s, 140s, okay? I would simply say let's start off with diet and exercise. Diet and exercise should be in everybody's regime, even if the blood pressures have been elevated, because you have to get to the root cause. From an exercise standpoint, start exercising, start moving. The body is not designed to lay still. Just as a short little digression here, you've heard of Newton's laws, right?
Right.
Back in physics,
Right.
A body in motion will stay in motion, right? Well, Newton's law is a body at rest will be laid to rest. So
That's a good one.
So I encourage people to keep moving.
Oh, that's good.
So
A body at rest.
will be laid to rest. So please keep moving, exercising. So number one is exercise. 2 is diet, cutting out salty foods, refined foods, processed stuff, sugary foods, high saturated fat foods.
Okay.
Replacing that with things that can actually help, such as vegetables, fiber, fruit, lean meats. Don't have to go for the fried foods, go for the more leaner meats. These will all help balance out blood pressure. You don't have to have ketchup. You don't have to have the Thousand Island dressing and all that, because they've got a lot of salt and a lot of other artificial preservatives. A lot of our food, and the American diet has a lot of preservatives in comparison to nutrition in other parts of the world. We've actually got one of the highest in the world. And that's not good, because that translates into all these various chronic illnesses, right? Which eventually will translate into worsening illnesses like stroke, heart disease, kidney failure, etc. And you cut out things like that are already going on, such as excessive alcohol, cutting out the smoking, doing more breath work, meditation, watching out. Okay, am I always stressed only at work, and is that when my blood pressure always goes up? But yet when I go home, my blood pressure is fine, or vice versa, right? What's the cause for the blood pressure to go up? Because as I said earlier in the beginning, the blood pressure is a beautiful marker to follow in terms of the functional status of somebody and how they're living their life. If somebody is perpetually stressed all the time, the blood pressures will be perpetually stressed, and reveal that in the numbers.
That's really interesting. You've got some great sayings here. I'm enjoying this, I have to say. Well, I think you've already answered that. I was going to ask, is medication always indicated? But not necessarily.
Not
It could be
necessarily.
diet and exercise
Right.
for certain.
As the example I told you about the sleep apnea, if you fix the sleep apnea, the blood pressure issues have been solved.
Yeah.
You don't need the medication for it. You just need to treat the sleep apnea. But maybe the sleep apnea started because of bad diet and ill health, and being overweight or having a thick neck because of that body habitus from that. You now improve the diet, you move the exercise, and you start reducing the weight. Sleep apnea also improves. Now you've now resolved the blood pressure. Let's say if it was the diabetes, you bring down the sugars, keep those in tighter management, tighter control, and the blood pressure automatically improves.
Right. Let's talk about exercise. You are an active athlete yourself, a Ironman, which I'm very impressed with, and marathoner and cyclist. So when you look at trying to lower blood pressure through exercise, which is that and diet are two of the easiest things you can do before you have to get into medications and stuff. What do you think of as far as types of exercise? Is it walking? Is it running? How often? How long?
A beautiful question, but you have to always see who the person we're talking to.
Okay.
And it has to be tailored to them.
Okay.
What I can do, somebody else may not be able to do. It always starts with walking, and then eventually running, and then eventually, building up your endurance. I tell everybody at least 20 minutes of exercise a day. Start off with 3 times a week.
Okay.
Then let's build that to 5 times a week. Then let's build that. This is my prescription that I created for myself and then for my patients. And then let's build that to 30 minutes a day, 5 times a week. Then let's build that to 45 minutes a day, to 5 times a week. And also making sure that your 2 rest days are interspersed. So it's not like you're going to do 5 days of exercise and then 2 days of rest. Maybe do 2 days of exercise, 1 day of rest, 3 days of exercise, 1 day of rest, or vice versa, whatever the case might be. So see what it is that they're able to do. So many of my patients are not able to even do any running because they're using a walker. Well, maybe you can simply start doing some squats, some nice and easy squats. You can start doing some, while you're sitting on a chair, moving the legs. Right?
Oh, yeah,
you
sure.
start building that. Once you start building and toning muscle, now
Right.
you can start, okay, so now I'm going to do some more walking.
Right.
And at some point, maybe I'll go for longer distances. You can even do this. Walking is so simple that you can even do it in your own house. You know, you can even go from one end of the house to the other. You can go outside. The weather is nice, and keep going and doing that. The other things in terms of other causes is hydration. Like today is a very hot day, so we're going to probably experience people having lots of high blood pressure, because the first thing what happens is the blood pressure goes up as a response to the external climate. The drop in blood pressure when it's too hot is when you've already overshot the mark. You're already quite dehydrated by then. So
that's interesting.
I actually find even in wintertime, when people usually try not to drink as much water because they feel cold or whatever the case might be, dehydration is a significant cause of the high blood pressure. I really encourage people to hydrate. And again, how much of water? Well, that has to be tailored to the person. I do about 120 ounces a day of water. However, somebody who is half my weight and does less exercise than me, then will easily say, well, I can't do that. I can only get to 60. That's fine too. You've got to be able to stay hydrated. We're all about 70% water. And all of that is also in our blood, right? It's also in lymphatics, it's in the tissues and so on. But the blood causes the change in the force against the blood vessels. And we are 70% water. So the amount of hydration we have will also now change the amount of blood pressure that we're able to exert.
Well, there's a lot of factors here. Listen, I want to talk about blood pressure medications, because you read about them you see them on television all the time, and a lot of people are using those. Are there some medications that are very common? You're referencing new medications that are controlling multiple kinds of issues. How, as a physician, do you even stay up to date with everything that's out there?
We all try to be as much as possible. But as far as the side effects, anybody can have a side effect to anything. And the side effects can be very bizarre. For example, like I've seen people take Tylenol and have a headache. So the whole purpose of taking Tylenol is for pain and headache. But yet the side effect is the headache. So ironically enough, somebody can have a side effect to pretty much anything. It just depends upon what their DNA constituency is. And we won't know until you try.
Right.
That's where the art and the science of medicine blend in one another.
Right. And I'm guessing that if a person is coming in and is diagnosed with high blood pressure, are you looking at diet and exercise first, or would you automatically go to medication depending on what their situation is?
I look at diet and exercise first for everybody.
Okay.
And in addition to that, now I decide, do you need blood pressure, or can I wait? Let's put it this way. Can I have the luxury of waiting for diet and exercise to work before committing you to blood pressure medication?
That's an interesting point. Okay.
So if I can wait for a couple of months because the blood pressures aren't that high,
right,
that's part of it. And also, what is the blood pressure really doing? Right? Is it just because you've also got this whole white coat hypertension, where somebody only has a high elevated blood pressure when they come to the doctor's office or the dentist's office and things like that? The blood pressures at home are fine. It's only when they come into that office the blood pressure goes up. So therein lies another conundrum. Do I put them on a medication or do I not? I would not, because if their blood pressures are 115 by 70, let's say, right, on a regular time in their home life, then there's really no reason, and it's only the blood pressure gets elevated when they're stressful environment, like coming to the office, different story.
So anxiety can have a tremendous impact on blood pressure.
Absolutely, because blood pressure is again your flow of blood. Your flow of blood changes based on the vasculature and your dilation and constriction of blood vessels. That's controlled by hormones. That's controlled by the nervous system. And the nervous system has a direct impact directly to your consciousness and to your mind and what your state of mind is at any time.
Is blood pressure hereditary?
It can be, yes.
But not necessarily?
Not necessarily, no.
Okay, so anybody could get it. You don't, okay.
Right.
But it's good to know the family history in case
Yes.
there is something. Really, really, really interesting, that's for sure. So when we look at medications, we talk about being an overly medicated society in some cases, which the drug companies love.
Unfortunately.
Yeah, unfortunately. You've mentioned some side effects. Is it expected that there would be side effects or not necessarily?
Not necessarily.
So some people could take medication and not experience anything
Correct.
out of their normal life
Right.
and how they feel.
I have some patients who have a long laundry list of allergies as long as my arm. And there are those who will take a list of medication as long as my arm and have no allergies.
Right.
It just varies.
Right. You mentioned it earlier, and I wanted to follow up on it, artificial means by which to take your blood pressure. So we see a lot of things now. We have apps on our watches and the Apple Watches and the Fitbits and all of these other mechanisms and means by which people can monitor their blood pressure. Are those reliable? Are those good indicators, or should we really not be taken in by the sales pitches of a lot of these items that people are trying to sell?
Excellent point. I would say caution is warranted. I have seen plenty of patients who come in because their watch will tell them that they're in these rhythms called atrial fibrillation, for example.
Right.
And they'll come and say, oh, my watch said I'm in atrial fibrillation. I ask them to download the data for me, and they download it. I look at the actual tracings and their normal rhythm. So the technology is not necessarily giving us the right data. There are other actual bona fide machines that will check for AFib, and those are more accurate because they've actually been compared in clinical trials, and those are more reliable. I would say that the watch and these apps will help you get into the office for an evaluation.
Okay.
And that's when we can provide more education and say, all right, do you truly have high blood pressure or not? Let's not look at the watch, but let's get a proper blood pressure cuff, not for the wrist or for the thumb, but something for the actual arm. And keep a diary, and now let's look and see where we're dealing with.
So it may give you an inkling that there may be an issue, but don't trust it.
And don't rely on it.
Don't self-diagnose based on
Right.
that.
Right.
You definitely need to get to a trained doctor. And
I have this funny sign in my office for humor than anything else that patients will be charged extra for Google-based diagnoses. So yes,
I like that.
it usually gets a good chuckle in there.
Oh, that's a good one. Oh my gosh. So to that point, where can people actually find more information on hypertension and the effects of high blood pressure? Because they do need to educate themselves to know what they're feeling or what they should be concerned with.
Well, since these days everybody is online for something or the other, you can go to the American Heart Association, and that will give you a lot of information of what's going on.
Interesting. And you mentioned earlier these public information sessions, and I think that's something that you're interested in doing as far as what do you envision? When does that start? Have you been able to put any detail of that yet, or is that kind of a global thought of where we're headed?
I've got a plan for it, and I'll share that with you. The thought is, at least for the town of Westfield, is we have these town sessions. This is great because this also provides a lot of data to a lot of people and a lot of access to people. But if people are interested, we can have these town hall meetings, as it were, and just for like an hour, and then where people can come and present from different disciplines. I'm not just thinking of cardiology and talking about, okay, I'll talk about high blood pressure, cholesterol, I'll talk about heart disease, risks and things you need to watch out for from looking for a heart attack. But I'd like to also bring women's health to come and talk about women's health. I would like to bring dentists to talk about plaque.
Oh, yeah.
Talk
That's a
about
great point.
bring chiropractors in to talk about how important that kind of health is. How do you get an adjustment? What is an adjustment? How does it infect your whole body? And how does it transform your body by getting an adjustment on a regular basis? What's so important about physical therapy? Getting all the disciplines of medicine as much as possible. Get a nutritionist to have a topic discussion. So if we can get the town to be more receptive to coming and just for an hour session and pack it in with everybody, and we can ask questions and just, we're not giving necessarily individual specified advice, but give enough knowledge for you to be able to now go back to your healthcare professional and say, all right, this is what's going on with me. This is what I'm learning. And how do I help myself? Because in the average time, somebody sits in the office with their healthcare professional 15 minutes, 20 minutes on average. Maybe that's not enough time to be able to think up of all the questions. But if you already had the time because you've had some sort of education in the background, now you can ask the right questions. I firmly believe that the quality of your reality is based on the quality of questions you ask. So if you know what your questions are and you ask the right questions, the answers will develop themselves and your reality is created.
Quality of reality
is based on the quality of questions that you ask.
On the you got some great sayings. These are questions. That's a good one, and that is so true.
And more importantly, also less fear. So when you go into the office, now you've got less fear. Right. And much of the time, people are not accessing healthcare, whatever the healthcare may be, until it's too late because they're too afraid of what's going to happen.
Right.
Right. The secret to knowledge is to sharing it with the world. There's no value in hoarding knowledge. So the more we are able to provide information and knowledge to people, the more aware they are, the more empowered they'll be to be able to take care of themselves.
Really interesting.
Because that very concept is that you will be able to heal yourself. And the body has a natural ability to heal itself. And so my goal is, and has always been, to be able to teach people enough to be able to, for them to start working on ways to be able to heal themselves. They can heal themselves through diet. They can heal themselves through exercise. They can heal themselves through meditation. They can heal themselves through breath work. They can heal themselves through just changing their stress environment. Cutting back on foods that are not good for them. Functional movement, functional nutrition. Let's put it that way.
Interesting. So if a person is suspecting that they've got a high blood pressure issue, what is their first step, or what's their next step? Should they be going to their primary care? Should they be going to a specialist? Should they go to the emergency room?
Well, it depends upon what the blood pressure is. If the blood pressure is super high, like in the 170s, 180s, or whatever, and they're having symptoms like chest pain, shortness of breath, headache, vision changes, arm weakness, because that could be the first sign of stroke, then get to emergency care immediately. The other thing is then contact your primary and try to find a healthcare professional, whoever that may be, to be able to try to see, I need an appointment, my blood pressure is elevated. In the meantime, what they can do is to start taking out salt, getting more hydration, making sure they've got enough magnesium in their diet, because that will also help, right? Removing things like the alcohol. If they're a smoker, stop with the smoking.
Yeah, right.
Things that they can do, because we have actually a lot more control of our lives than we care to believe. I've always been of firm belief that anything that we think that we have control over, we actually don't. And things that we don't have control, we think we have no control over, we actually do. So we think we have no control over our health. We actually have 100% control over our health. So do these various changes, get to see somebody, get a blood pressure monitor, let's get some readings in the meantime while you get to that appointment. And now you've got a more valid discussion, a more interesting discussion to have with your primary and say, okay, I've got my blood pressure readings. I am also seeing a trend. Now let's come together to be able to make me feel better. But the more data you have, the better you'll be.
You talked about stroke a couple of moments ago. Is that generally considered to be the outcome of high blood pressure?
It can be. I have seen heart attack. I've seen I've seen kidney disease, kidney damage.
So other things,
vascular disease.
All right. So it's not just.
Think of it this way: the stroke is more like a heart attack, but for the brain. And if you look and see all end organ damage, that could have all been avoided, because that's the final stage. That's the body finally saying, listen, I've been in so much of disequilibrium all this time. You're not listening.
Yeah.
And now illness is set in, because the point of crossing that threshold of wellness was ages ago.
Yeah. Wow. This has really been interesting. So what have we not talked about that we should be helping to inform our viewing audience? Is there anything else that you can think of offhand? We've covered a lot of ground here.
Do you have a couple of hours to spare?
Well, we got a couple of minutes anyway.
No, there's you have to start with awareness.
Yeah, okay.
And once you've got that awareness and you've got the willingness to want to do something for yourself, not living in the fear of what can potentially happen, and not taking that step to be able to explore that. Right? And we all live in our comfort zones, but life is actually not living in the comfort zone, it's living outside that comfort zone. So that's where the whole mind-body connection comes in, and try to figure out what is actually going on. It is, think of it this way, it is the way the body is simply trying to tell you that you're out of alignment. So whatever your illness may be, even if it's blood pressure, try to start asking that question. All right, what is out of alignment? Whether it's socially in the life, in the family, finances, mentally, physically, spiritually, vocationally, any of the major 7 areas of life, what is out of whack? And then start listening to your body, and then moving forward, get the help. There is help available. Get the help that you need.
Yeah, that's a great saying. You know, I have been fascinated the entire time we've been sitting here talking, and I can see why you have been welcomed with open arms to the Board of Health. You are going to be a phenomenal resource to them and their work, but to our community as far as educating us as a community on better ways to stay healthy, what it means to be healthy, and then how to diagnose and find treatment when we're not healthy, when we're out of balance.
Well, thank you.
The things that I have really enjoyed, you've got some great sayings here. This one has to be the topper. A body at rest will be laid at rest. That is a good one. I hope you all are listening to this out there in our viewing audience. The quality of reality is based on the quality of questions you are asking. Find ways to heal yourself. Stroke is basically a heart attack of the brain. I liked that. And what is out of alignment in our lives, we need to figure that out to find out what the cause is.
Right. Whatever's out of alignment in our lives is a reflection in our bodies.
Yeah, no, absolutely. And I thought, and out of balance wellness. That was another good one. But so I want to ask you this. Where's your office located?
We're right here on Springfield Street, down in Westfield, 65 Springfield Street.
Okay.
Yep, I go to different offices as well, but for Westfield, this is where I go. I also go to Holyoke, and I go to Greenfield.
So you do move around. Okay.
Right.
And do you take patients?
Yep.
You're taking patients?
Yep. So Myself and my partners are all taking patients.
So if people are interested in following up with you,
absolutely,
because they saw this interview and were so inclined, they could reach out.
Absolutely. Yeah. And also reach out to your primary care doc. Start off with there.
Yeah.
And I'm sure they'll love the opportunity to be able to help and have a frank conversation. Right. Don't be afraid to have the difficult conversation. Right. That's a great way to start when you go and see your healthcare professional. I'll leave you with this one saying, since you like saying, this is a Buddhist saying, and it's from the Eastern philosophies. When the teachings, so Buddha had said this, my teachings are like a raft to help humanity reach the far shore. But I hope that humanity will not make the mistake to think of the raft as the shore. So there is more opportunity to reach the end. It's not just you listen to this whole interview, but now you need to take action steps. Right. Got to start looking at my diet, looking at my functional abilities and my functional movement. Right. Let me start living a more functional life, not just, I got the advice and that was the end of it.
Right.
Start putting it into action.
Well, Dr. B, I want to thank you so much for coming in today. You have been a wealth of information, absolutely fascinating to listen to this. Our newest member of our Westfield Board of Health, I think, again, as I said, I think you're going to be a welcome addition to them. As I listen to you, I'm just enthralled with everything I've learned already. But what I will remind our viewing audience is I think this is just the tip of the iceberg. We have talked about a lot of information here, but what it says to you is that there's a lot yet to learn. Be conscious of how you're feeling. Be conscious of your own lifestyle. Try to control the controllable risk in your own lifestyle versus weight, exercise, high blood pressure, diet, smoking, alcohol. All of those are factors that can make you feel better and allow you to live a healthier lifestyle. And recognize that it's not just one thing that may be affecting you, but it may be the result of a number of other issues going on. So you need to get into a trained professional, and don't always trust the electronic things that you will find in some of our department stores and grocery stores. It may be an indicator, but you really need to see a trained professional to do that. With that being said, we're going to wrap up by saying thanks to Pete Coles, our WCPC Westfield Cable Channel 15 manager and producer, for his help and support to make this show possible. And on behalf of Pete Coles, Mike Squindo, Tina Gorman, I am Harry Rock, and this has been another edition of the Westfield Council on Aging Presents on WCPC Westfield Cable Channel 15. Have a great day, everybody. We'll see you on the next show. Thanks.